It is noteworthy that consuming certain types of nuts on a regular basis may elevate your risk of heart disease by as much as 48%, particularly for individuals who are in their 60s or beyond. This number is not arbitrary. It is derived from a specific analysis. This information is derived from a comprehensive multi-year study featured in the Journal of the American College of Cardiology. The unsettling aspect. Numerous older adults believe they are opting for healthy options, yet certain widely used nuts in their kitchens can insidiously elevate blood pressure, provoke inflammation, obstruct arteries, and potentially exacerbate cognitive decline. A specific nut, which we will disclose later, has been associated with increased levels of a harmful compound that can build up over time and potentially harm your liver, kidneys, and cognitive function if ingested regularly. Indeed, the very nut frequently suggested for low-carb diets may be causing lasting damage to aging bodies, and it's likely sitting in your snack jar at this moment. Rest assured, as this video will provide a comprehensive breakdown of everything you need to know. This comprehensive guide covers the most beneficial nuts for heart health and cognitive function that you should incorporate into your diet, as well as those you should eliminate without delay. Be sure to stay tuned until the conclusion, as the top entry on the negative list harbors a concealed truth that is rarely discussed, and it may be significantly impacting your health without your awareness. Before we dive in, please share in the comments where you're tuning in from. Also, remember to give this video a thumbs up and subscribe to our channel for more content like this. Without any delay, let's dive into the 4 nuts that are beneficial for seniors to include in their diet. Fourth on the list, almonds stand out as a remarkable source for enhancing bone strength. Almonds are an exceptional food choice for those in their later years, primarily due to their impressive levels of calcium and vitamin E, which together play a crucial role in preserving bone density. With advancing age, the natural process leads to increased porosity and fragility of our bones, resulting in a heightened risk of fractures that can pose significant dangers. A mere quarter cup of almonds each day delivers approximately 97 milligrams of calcium, playing a crucial role in mitigating the natural bone loss that tends to accelerate post-age 65. The unique quality of almonds lies not only in their calcium content, but also in the way they deliver magnesium, a mineral that is often lacking in the diets of many seniors. This form of magnesium serves as an essential transport mechanism, ensuring that calcium effectively reaches the bones instead of accumulating in the arteries, where it may lead to harmful consequences. The monounsaturated fats found in almonds play a crucial role in promoting heart health by aiding in the reduction of LDL cholesterol levels. This aspect becomes particularly significant as the risk of cardiovascular issues escalates with advancing age. It is advisable for seniors to include approximately 15 to 20 almonds in their daily diet, ideally in their raw or dry roasted form without any added salt. The fiber content in almonds, approximately 3.5 grams per serving, plays a significant role in alleviating constipation, a prevalent issue impacting nearly 40% of older adults. Notably, research from Tufts University indicates that the distinct antioxidant profile found in almonds plays a significant role in safeguarding brain cells against oxidative damage, which may help mitigate the cognitive decline that often concerns individuals as they grow older. When selecting almonds, prioritize those that retain their skin, as the skin is rich in flavonoids that synergize with vitamin E to enhance antioxidant effectiveness. It is essential to chew almonds thoroughly, as they may present a choking risk for seniors experiencing swallowing difficulties. Thirdly, we have walnuts, renowned for their cognitive-enhancing properties. Walnuts stand out as a remarkable source of nutrition for seniors, and it's interesting to note their physical resemblance to the brain, the very organ they support and safeguard. These exceptional nuts boast the highest concentration of alpha-linolenic acid found in any common nut, a noteworthy plant-based omega-3 fatty acid. This is of great significance for aging brains, as omega-3s play a crucial role in preserving the integrity of brain cell membranes and enhancing neurotransmission. A significant study published in the Journal of Nutrition revealed that older adults who incorporated 1.5 ounces of walnuts into their daily diet for 8 weeks experienced notable enhancements in cognitive processing speed and mental flexibility. The distinct polyphenolic compounds found in walnuts have the ability to traverse the blood-brain barrier, directly combating inflammation within neural tissues. This mechanism may play a role in decelerating the advancement of conditions such as Alzheimer's and dementia. It is often overlooked that walnuts are a source of melatonin, a hormone that tends to diminish with age, leading to the sleep issues frequently encountered by older adults. Incorporating a small handful of walnuts into your evening routine can significantly enhance the regulation of your sleep-wake cycle. Walnuts offer significant cardiovascular advantages due to their unique blend of arginine, an amino acid that enhances blood vessel function, and polyphenols that help mitigate oxidative stress. For seniors on blood pressure medications, incorporating walnuts into their diet can effectively support these treatments by promoting arterial flexibility. For optimal benefits, it is advisable to refrigerate walnuts to safeguard their delicate oils from oxidation, and it is recommended to consume approximately 7 to 9 walnut halves each day. We recommend cracking them yourself whenever feasible, as this activity serves as a gentle hand exercise that helps maintain fine motor skills. The subtle bitterness found in walnuts serves as an indicator of their robust antioxidant properties, so there's no need to shy away from this naturally protective flavor. Pistachios serve as an effective regulator of blood pressure. Pistachios are often overlooked in discussions about senior health, especially regarding their role in supporting healthy blood pressure levels. Pistachios are distinguished by their remarkable potassium to sodium ratio, offering approximately 285 milligrams of potassium per serving and maintaining a naturally low sodium content. The balance of minerals is especially important for older adults, as it can help mitigate the sodium retention that often occurs with aging kidneys. This adjustment may lead to a reduction in systolic blood pressure by 3 to 5 points, an effect similar to that of certain prescription medications, but without the associated side effects. The presence of lutein and zeaxanthin in pistachios is noteworthy, as these carotenoids are known to specifically benefit the macula of the eye. This protection is crucial in combating age-related macular degeneration, the primary cause of vision loss in individuals over the age of 60. Pistachios offer a uniquely satisfying crunch that is gentle on aging teeth and gums, making them a preferable choice compared to harder nuts that may present dental challenges for seniors. Their unique green and purple colors are not merely attractive. They indicate the presence of antioxidants that play a crucial role in neutralizing free radicals, which contribute to the aging process in the body. Pistachios offer a practical benefit that is particularly advantageous for seniors. Shelling them inherently reduces consumption, helping to prevent overeating while offering a mindful eating experience that can be both meditative and beneficial for cognitive function. A study featured in the International Journal of Obesity indicates that the presence of visible empty shells acts as a visual cue for consumption, aiding seniors in more effectively managing their intake. Individuals experiencing arthritis in their hands should consider selecting pistachios that are partially opened. This choice facilitates easier access while still allowing for the advantages associated with the shelling process. It is advisable to consume approximately 49 pistachios each day, which equates to 1 ounce, with a preference for unsalted or lightly salted options. The fiber content in pistachios, approximately 3 grams per ounce, plays a crucial role in regulating blood sugar levels. This is especially significant for the 25% of Americans aged 65 and older who are affected by diabetes or prediabetes. First and foremost, Brazil nuts are known for their beneficial effects on thyroid health. Brazil nuts hold the highest rank on our list due to their significant role in supporting a crucial yet frequently neglected aspect of senior health: thyroid function. These exceptional nuts stand out as the most abundant food source of selenium, with a single nut providing 96 micrograms, equating to 137% of the daily requirement. The significance of this issue cannot be overstated. as thyroid disorders impact nearly 20% of individuals over the age of 65, with a considerable number of cases remaining undiagnosed due to symptoms frequently being misinterpreted as a natural part of aging. The selenium found in Brazil nuts plays a crucial role in the conversion of thyroid hormone into its active form, thereby directly supporting energy production, metabolic function, and mood regulation. In addition to their role in supporting thyroid health, Brazil nuts are rich in distinctive fatty acids that contribute to the maintenance of myelin, the protective sheath surrounding nerve cells, which often deteriorates as we age. The preservation of myelin is likely to enhance coordination, reaction time, and cognitive processing speed in seniors. Brazil nuts are particularly intriguing due to their provision of organically bound selenium, which is more bioavailable than synthetic selenium supplements. This means that your body can utilize it more effectively. The rich, creamy texture of Brazil nuts renders them quite satisfying even in modest portions, which is crucial given that their potency allows for significant benefits with just a small quantity. It is advisable for seniors to restrict their intake to 1 or 2 Brazil nuts per day, as an overabundance of selenium can be detrimental. Opt for Brazil nuts that are still encased in their shells whenever feasible, as this natural barrier aids in maintaining their nutrient integrity for an extended period. It is advisable to keep them in the refrigerator to avoid the risk of their high-fat content becoming rancid. For seniors experiencing constipation, Brazil nuts provide valuable advantages due to their unique blend of fiber and natural oils that support bowel regularity. Their inherently sweet and buttery taste positions them as a superior alternative to less nutritious snacks that often appeal to seniors seeking comfort. Notably, recent studies indicate that the unique antioxidants found in Brazil nuts could play a role in safeguarding telomeres, the protective caps on chromosomes that generally diminish with age, thereby potentially affecting our aging process at the cellular level. These nuts are highly recommended for consumption after the age of 65. Now let's transition to discussing nuts that older adults should consider limiting or approaching with care. Fourth on the list, we have peanuts, recognized as a potential inflammatory trigger. While widely enjoyed, peanuts present various risks that can be concerning for numerous seniors. Initially, it is crucial to recognize that peanuts are not genuine nuts. Rather, they are legumes that develop beneath the soil. This unique growth environment renders them especially vulnerable to mold and aflatoxins, naturally occurring mycotoxins generated by specific molds. These substances can harm the liver and potentially elevate cancer risk with regular consumption. The likelihood of this risk escalates with advancing age, as the body's natural detoxification mechanisms tend to diminish in efficiency. It is particularly alarming for seniors that peanuts possess proteins capable of inducing inflammatory responses in numerous individuals, even in the absence of a genuine allergy. This mild inflammation can worsen joint discomfort, heighten cardiovascular strain, and potentially speed up cognitive deterioration, all of which are 3 aspects already at risk in older adults. The elevated levels of omega-6 fatty acids found in peanuts exacerbate this issue, given that the average American diet already includes an excessive amount of omega-6s compared to the beneficial omega-3s that help combat inflammation. For seniors on blood thinners such as warfarin, the presence of vitamin K in peanuts poses a risk of interfering with the medication's effectiveness, an important interaction that is often overlooked by healthcare professionals. Many commercial peanut butters exacerbate these concerns by incorporating hydrogenated oils, excessive sodium, and sugars, which can place additional strain on aging cardiovascular systems. Natural peanut butter often includes added salt, which can contribute to elevated blood pressure, a significant issue for the 63% of American seniors affected by hypertension. Storage issues pose a significant challenge, as peanuts that are not stored correctly can become rancid, leading to the formation of harmful free radicals. The standard dry roasting method employed for the majority of commercial peanuts results in the formation of acrylamide, a compound that studies indicate could potentially hasten cognitive decline, raising particular concerns for individuals already apprehensive about memory impairment. For those who have been consuming peanuts without noticeable problems, making a shift to one of our suggested nuts for even 3 days a week can enhance your nutritional intake and minimize exposure to certain undesirable compounds. Thirdly, cashews can lead to unexpected sugar spikes. Cashews pose a notable issue for older adults due to their unexpectedly elevated carbohydrate levels and significant glycemic effects. In contrast to genuine tree nuts, cashews have a notably higher carbohydrate content, approximately 9 grams per ounce, and a lower amount of fiber protective compounds. The blood sugar response generated by this can pose significant challenges for the approximately 25% of adults over 65 diagnosed with diabetes, along with the further 48% who are classified as pre-diabetic. The situation is particularly concerning because cashews are often perceived as a healthful choice, which may lead many seniors to indulge in them without understanding the potential impact on their glucose levels. The curved and smooth shape of cashews contributes to their status as one of the most frequently aspirated nuts among seniors, posing a significant choking hazard that must be taken seriously, especially for individuals with swallowing difficulties. From a nutritional perspective, cashews are notable for their high oxalate content, compounds that can bind to calcium in the digestive system, thereby diminishing calcium absorption. This poses a considerable concern for seniors who are already at risk for osteoporosis. Oxalates can significantly contribute to the formation of kidney stones in individuals who are predisposed, with the risk notably rising after the age of 60. The processing involved in cashew production reveals an additional underlying challenge. Cashews require significant processing to eliminate urushiol, the toxic compound also present in poison ivy. This processing typically involves high temperatures, which can compromise their nutritional value. Many commercial varieties undergo oil roasting and are heavily salted, which introduces unhealthy fats and sodium that can raise blood pressure and put additional strain on the cardiovascular system. It is important to note that cashews possess enzyme inhibitors that may hinder protein digestion. This can pose significant challenges for seniors, who frequently experience diminished digestive efficiency and difficulties with protein absorption. The rich, creamy texture of cashews enhances their appeal, but it also increases the likelihood of overconsumption, which may lead to weight gain during a life stage when managing a healthy weight becomes more difficult. For those who have been consistently incorporating cashews into their diet, it may be beneficial to transition to walnuts or almonds. These alternatives offer superior nutritional benefits and pose fewer risks, particularly for aging individuals. 2. Macadamia nuts, though undeniably tasty, pose significant challenges for seniors, largely because of their remarkable caloric density. With around 200 calories per ounce, these nuts stand out as the most calorie-dense option on the market. This issue becomes particularly alarming as metabolic rates inherently decrease with age, rendering weight management more difficult for older adults. Their notably elevated fat content, approximately 22 grams per ounce, imposes further demands on gallbladder function, which generally tends to decline in efficiency with age. For the estimated 15% of seniors with asymptomatic gallstones, the consumption of macadamias can provoke painful episodes that may otherwise stay inactive. In addition to their caloric content, macadamias are notable for having one of the highest levels of saturated fat among nuts, with approximately 3 grams per ounce. This can lead to increased LDL cholesterol levels, a significant concern for many older adults. Their hardness and density pose considerable dental risks for older adults with crowns, bridges, or compromised teeth, particularly after the age of 65, when prolonged wear and diminished calcium absorption can weaken dental integrity. From a practical perspective, macadamias rank as some of the priciest nuts, which may prompt budget-conscious seniors to opt for lower-quality alternatives that could be rancid or inadequately stored, thereby heightening the risk of exposure to harmful oxidized fats. Macadamias found in the market are frequently subjected to excessive salting and oil roasting, which introduces unwarranted sodium and compromised fats to a nutritional profile that is already concerning. Their rich, buttery flavor can lead to overconsumption, particularly among seniors who might experience reduced taste sensitivity and thus gravitate towards more intense flavors. It is quite alarming that numerous seniors opt for macadamias under the impression that they are making a beneficial choice for heart health, unaware that the research advocating for nut consumption in relation to cardiovascular health has specifically excluded or restricted high-fat varieties such as macadamias. If you have been incorporating macadamias into your diet, it may be beneficial to shift towards pistachios. They offer a comparable enjoyment while boasting a more advantageous nutritional profile, particularly for those in the aging demographic. First and foremost, pine nuts are a remarkable ingredient. Pine nuts have emerged as a significant concern for seniors, presenting various serious issues that directly affect older adults. It is particularly concerning that these compounds have the potential to interact with more than 60% of medications frequently prescribed to seniors, which could lead to diminished drug effectiveness or the emergence of hazardous side effects. The interactions are notably significant with blood pressure medications, statins, and specific antidepressants, which are commonly prescribed to individuals over the age of 65. The significant concern lies in the fact that many healthcare professionals, including physicians and pharmacists, often fail to inform patients about this critical food-drug interaction. One of the more troubling issues is pine nut syndrome, a condition in which the consumption of pine nuts leads to a lingering bitter metallic taste that may persist for weeks. Although this may appear to be a minor inconvenience, for seniors it can have serious consequences, as alterations in taste frequently result in diminished appetite and a decline in nutritional health. Research indicates that as many as 42% of those impacted undergo considerable weight loss as a consequence. The syndrome seems to impact older adults more significantly, likely as a result of age-related alterations in taste receptors and detoxification mechanisms. Pine nuts are known to have elevated levels of polyunsaturated fats that can oxidize rapidly, leading to the formation of harmful compounds. These compounds may exacerbate inflammation in the body, posing challenges for seniors who are already dealing with inflammatory conditions such as arthritis. The diminutive size and slick texture present a notable aspiration risk, particularly for older adults who experience swallowing difficulties or those on medications that induce dry mouth, a condition prevalent in over 70% of seniors managing multiple prescriptions. Pine nuts possess enzyme inhibitors that may disrupt protein digestion during a life stage characterized by a natural decline in protein absorption efficiency. In pesto, which is one of their most prevalent culinary uses, the elevated oil content paired with pine nuts results in a calorie-rich food that may pose challenges for weight management, particularly for individuals over the age of 65. Emerging studies indicate that compounds found in specific varieties of pine nuts may contribute to the acceleration of age-related macular degeneration, a condition recognized as the primary cause of vision loss among seniors. These are the 4 nuts you may want to steer clear of after the age of 65. Making informed choices about the nuts you incorporate into your daily diet can greatly influence your health, energy levels, and cognitive function as you age. Ultimately, it's important to recognize that even minor adjustments, when implemented consistently, can lead to extraordinary outcomes over time. We invite your insights and perspectives. Have you observed any positive or negative shifts in your health after incorporating or eliminating specific nuts from your diet? Which nut had the most significant impact on your experience? We invite you to share your insights and experiences in the comments below. Your contributions are highly valued. I appreciate your viewership.